So let's say we've done our physical exam, we've done our outcome measures, we've figured some things out where the problem is. I always joke with everybody that I wasn't born on Krypton. I don't have X-ray vision. Right? I think it's osteoarthritis. It's an elbow. It's restricted. It doesn't let it flex. It's big and it's convex and it's puffy, and I can't extend it all the way and it hurts. Okay, here's my problem. But we need to get some radiographs to confirm that, right? Because we have a suspicion that it's osteoarthritis, but if it's a middle-aged dog, it could be some other things. And especially if it hasn't responded to NSAIDs, right? Now let's come back and figure out the why. Are we missing something? If we're going to do that, we need to get some radiographs. We need to get well-positioned radiographs. We need to get orthogonal views, so lateral and an AP, right? We're going to get off angle. We have to remember that these dogs hurt. So I think the safest and most complete way to get a good understanding of exactly what's going on there are sedated radiographs. Sedated radiographs safely can allow us to position that dog in the spots it needs so that we can get our radiographs done. It allows us to minimize our exposure to radiation as well, but allows that dog to be in those different positions to get those radiographs so we get an understanding of what's going on. We can then also send those out. If you're not comfortable with it, you can send those out for a radiology read and get confirmation back. If you're not sure, if you're dealing with a really young puppy, right? Or you're not sure with what you're dealing with, that's okay, right? Get the other leg for comparison, right? Just have an understanding, especially with puppies with all those little growth plates everywhere. Everything looks really odd. Just get the other leg for comparison, right? But get those individual views. While you're there for those sedated radiographs, here's a good chance to come back and do a sedated orthopedic exam. Right? So let's say the dog was super painful, right? It wouldn't let you flex it. Well, was it super painful or was there something wrong? You've sedated them. Now can you bend that elbow again? Maybe you can bend it a little bit more. Maybe you find something else. So you can come back and feel that elbow. You can even come back and feel that hip or that knee. Sedated orthopedic exam is really important when you're going to look at the knee of a dog. There's been a couple of studies that have shown, didn't matter if you were a Chihuahua or a Great Dane, but dogs that came in with a suspicion of a cranial cruciate ligament tear, they had no instability in cranial drawer or cranial thrust awake. So we think that those are partial cruciates. They might be. Studies show that when they then put those dogs who had no mechanical stability awake, no mechanical instability awake, they put those dogs under anesthesia to get radiographs. They then repeated those cranial drawer and cranial thrust tests. About 50% of dogs that did not have instability awake did have it under anesthesia. And that's really important that we get the accurate diagnosis, because that changes possibly our recommendations from conservative management, joint injection, right? Rehabilitation. Maybe that's a dog we're then really getting ahead of it and recommending surgery. So your sedated orthopedic exam allows you again to go back through and feel all those things to correlate that with your awake exam and your radiographs so you get a complete picture.